video, we explain the proper protocol for when the pit crew methodology of CPR is used during a code blue. The first rescuer to arrive at the patient confirms there is no pulse and then hits the code blue button.
Your attention, please. Code blue CDU 121.
Pit crew CPR has an emphasis on starting compressions as soon as possible with as few interruptions as possible. Perform compressions at a rate of 100 to 120 per minute at a depth of at least 2 inches. The second team member to arrive takes an opposite position of the responder performing compressions. The second responder attaches the pads while compressions are ongoing to avoid interruptions of compressions. The third rescuer is going to prepare the bag valve mask and place it on the patient. Under ideal conditions, the mask would be placed by a responding respiratory therapist, but if the responder is a nurse, the therapist can take over this role once they arrive. If there is no advanced airway, use a 30-to-2 compression-ventilation ratio. If an advanced airway is placed, give 1 breath every 6 seconds with continuous chest compressions. Once a shockable rhythm has been detected, the first shock is delivered. If no other members have arrived, the second rescuer will take over compressions, trading roles with team member 1. If additional members have responded, compressions will be taken over by the fourth member to arrive.
Charging. Okay, clear. Shock. And resume.
Once compressors have switched roles, team member number 1 assumes responsibility for additional IV/IO access, as well as administering medication according to ACLS protocol. A team leader is always designated and is usually the provider that responds, but can be a shared role with the primary nurse caring for the patient or CRN. The team leader appoints ARN to be a recorder who documents each motion of the response. Respiratory therapy stands at the head of the bed. Additional responding team members such as radiology, lab, and pharmacy should not enter the room unless called upon by the team leader. Designate a place outside the room to stand that is out of the way of care taking place on the unit. Pit crew responsibilities focus on 3 primary goals: high-quality chest compressions with minimal interruptions, early defibrillation, and airway support. Pit crew CPR features a team approach that focuses on a single task: saving a patient's life.
Yeah.